Bismillahirrahmanirrahim. My name is Dr. Amber Arshad. Today, my topic of presentation is family planning and calculations of failure rate, and I am presenting under supervision of Professor Dr. Saira Afzal. In this presentation, I would be giving a brief introduction to what is family planning and what are the objectives of family planning. How family planning and SDGs are being covered overall globally. What are contraceptive methods? How to calculate the effectiveness of contraceptive methods, what are the unmet needs of family planning, and in the end, there would be some recent advances regarding family planning and an MCQ session. At the end of the presentation, the participant will be able to describe the fundamentals of family planning and how to calculate the failure rate for contraceptive methods. Now, what is family planning? Family planning is actually a way of thinking and living. It is a behavior that is adopted voluntarily upon the basis of knowledge and attitudes and responsible decisions by the individual and the couples in order to promote the health, the welfare of the family group, and thus it eventually contributes to the social development of a country. The main objectives of family planning is first to avoid unwanted births. Second, to bring the wanted births with regulate the interval between spacings, birth pregnancies, or you can say the third objective is birth spacing. Fourth is to control the time at which the birth occurs in relation to age of the parents. And last is to determine the number of children in a family. So here is a document presented by WHO under the title World Family Planning 2020. And according to it, among 1.9 billion women of reproductive age between 15 to 49 years of in 2019, 1.1 billion have a need for family planning. And out of these women, 842 million are using contraceptive methods and 270 million have an unmet need for contraception. References are given below. However, in Pakistan, there has been an initiative by the government, and there have been a special focus on family planning services. And Pakistan is commits to working towards achieving universal access to reproductive health and raising the contraceptive prevalence rate to 55% by 2020. And family planning is the main priority, and several initiatives have been taken in Pakistan. Several awareness campaigns have been done, and the main focus is also on the lady health workers that covers focusing the rural areas where the rate of contraception is slightly lower than the urban areas. So the use of modern contraceptives in Pakistan in private sector is more, around about 54% than the public sector 43%. This is the availability of the modern contraceptives in Pakistan. The methods that are being used in Pakistan for contraception are the top is the barrier methods, that is the male condoms around 36.8%, followed by the female sterilization 35.2%. Other methods of contraception being used in Pakistan are pills 6.8%, injectables 10%, implants 1.6%, intrauterine devices 8.4%, and lactational amenorrhea method is also being used 0.8%. The family planning and SDG sustainable developmental goals. Family planning is a part of the sustainable developmental goals, and by 2019, the overall family planning percentage was 75.7%. And this was the lower percentages of family planning were found in Middle and Western Africa. And the use of contraceptive advances the human rights to people to determine the number and spacing of their children. And another benefit for using the contraceptives is that it not only prevents the pregnancies but also the transmission of sexually transmitted infections, HIV, especially with the barrier methods, that is condoms. So these are the SDGs that focuses on the family planning and has an impact on family planning. Like for SDG 1, poverty related to poverty, hunger, good health, And the SDGs that indirectly affects the planet and have an impact on family planning are SDGs 6, 7, 9, 11, and 12. With prosperity focused under SDG 8 with decent work and economic growth. And partnership SDG 17 and peace under the SDG 10 that reduce inequalities, and SDG 16 that is for peace and justice. Now, the use of contraceptive prevents pregnancy-related health risks in women, especially in adolescent girls. And when births are separated by less than 2 years, the infant mortality rate is 45% higher than it is when the births are 2 to 3 years, that is 60% higher than it was birth are 4 or more years apart. Now here I would give a brief description of the methods that would be explained later in the coming presentations. So there are two methods. There are traditional and modern methods. Traditional methods include breastfeeding, abstinence, fertility awareness methods, that is rhythm and temperature chart methods. Whereas modern methods include barrier methods, combined oral contraceptive methods, progesterone only pills, IUCDs, permanent methods. So for the further classification for the modern contraceptive method, there are temporary and permanent methods. Temporary methods I've already mentioned are barrier methods, natural contraceptives, IUCDs, and steroid conceptions, while permanent methods in female is tubal ligation and in males is vasectomy. So while choosing the contraceptive method, dual protection, the concept of dual protection is kept in mind nowadays. And the concept is that using barrier methods, it not only prevents the chance of the incidence of pregnancies, it also decreases the risk of HIV or other STDs. Although hormonal contraceptives and IUCDs are highly effective at preventing, but they do not prevent STDs, including HIV. So there are two terms that need to be clarified before proceeding further, is that what are eligible couples and what are target couples. Whenever we are providing family planning services, we consider these two terms. For eligible couples, we define them as eligible couples refers to currently married couples, wherein the wife is in the reproductive age, which is generally assumed to lie between 15 to 45 years of age. And these couples need family planning services. Now the term has advanced, and there is another term that is targeted couples. Now the targeted couples, it targets the couples who apply to the couples who have 2 to 3 living children, and family planning was largely directed to these couples. So the definition of the target couple having gradually enlarged to include families with one child or even newly married couples with a view to develop acceptance of idea of family planning for the earliest possible stage. Now the another term nowadays used is the modern contraceptive prevalence among married women of reproductive age. And this percentage has increased between years 2000 and 2019 by 2.1%, from 55 to 57%. In Pakistan, there is an estimated of 31 million married women, and out of these 31 million, 8.1 million women are currently using these modern contraceptives. So, and out of these 8.1 million, 26.1% are using modern. However, 9.3% women are still using the traditional methods for contraception. So the reasons for this slow increase of this percentage is that there are several factors that affect this overall contraceptive acceptance in the community. That includes limited choices of methods, limited access to services, particularly among young and poorer and unmarried people, fear of experience of side effects, cultural and religious oppositions, poor quality of available services, and gender-based barriers. Here are the percentages for the reasons for not using modern contraceptives, and the need for more children is on the top. Now, what is the effectiveness and how to calculate the effectiveness and the failure rates for the specific contraceptive methods? So the effectiveness of the contraceptive method is measured by the number of pregnancies per 100 women using the method per year. There is another way of asking the effectiveness is the what is the failure rate that I would be explaining later on. So there is a grading for effectiveness. If zero, if less than one, if the effectiveness by the method comes out to be less than one, then it is a very effective method. If 1 to 9 pregnancies per 100 women is the answer, then the method is still effective. 10 to 19 pregnancies moderately, and more than 20 or 20 pregnancies per 100 women is less effective. So this is the chart showing the gradation of the contraceptives from less effective to more effective. The withdrawals, spermicides, they are the least effective methods for contraception. Whereas the barrier methods comes next, followed by the injectables, the lactational amenorrhea methods, and the pills. And the most effective methods for contraception are implants, the permanent methods of contraception, and IUDs, intrauterine contraceptive devices. So which contraceptive methods had the highest efficacy? So summarizing the whole table, the long-acting reversible contraceptive methods, that are the contraceptive implants. Mirena is most commonly used contraceptive, has more than 99% effective with perfect use. And the contraceptive methods with higher Pearl index numbers, that is the failure rate, are the least effective and are typically the methods that require daily usage, for example, the pills. Now the failure rate. This is a proper formula, a term Pearl index, that is used to determine the effectiveness of the method. And the formula that is used to calculate the failure rate for a particular method is the number of pregnancies multiplied is, since it is 100 women years, so we will multiply the total number of accidental pregnancies by 12 into 100, and then divided by the total number of women in the study and duration of the study in the months, or you can say the duration of exposure. And Pearl index is a very common technique for in the real world settings to estimate the efficacy and effectiveness of birth control methods. So for example, if you take 200 women and they were exposed to a contraceptive method for 2 years and total 6 accidental pregnancies occurred, then the failure rate would be calculated as we take total accidental pregnancies is denominator 6, the total exposure time is 2 into 12, that is 24 months. We have to take the total exposure periods in 22 in months. So whenever there is the duration in years, you have to multiply it with 12. So it is 24 months. So when we apply the formula, we get 1.5 per 100 women year. This is the table taken from the CDC, and it shows the general failure rates for each of the birth control method, and shown by the table the hormonal methods and the implants have the lower failure rates as compared to barrier methods and the natural methods for contraceptions. There is another method for calculating the effectiveness is the life table methods. The life table methods actually are the alternative for the Pearl index. And whenever we are studying the effectiveness of the methods, we use this table to rate each month of to rate the effectiveness of a method during each month of a year. Standard period is 12 months, and use of life tables eliminates the time related biases. For example, that is the most fertile couples getting pregnant and dropping out of the study earlier, and the couples becoming more skilled at using the method as the time goes on. And in this way, it is superior to Pearl index, but its application is limited to the theoretical purposes. So Pearl index is widely used method and commonly used method. This is the table. In first column, we have the length of exposure in months that goes up to 1 to 12 months. And the second column is still practicing contraception. Second is deliberately interrupting contraception. And last is the contraception failure. And the last column shows the total of all the columns. Here is another term that is the couple protection rate and the contraception prevalence rate. Actually, this my point of highlighting this couple protection rate is that it is the overall prevalence of the family planning practices in the community. It focuses on the acceptance of the family planning services in a community, and it is defined as the percentage of eligible couples effectively protected against childbirth by one or the other approved methods of family planning, that is sterilization, IUCDs, or barrier methods. And it is calculated in by dividing women of reproductive age who are married or in a consensual union and who are currently using any method of contraception. And if more than one method of contraception used, then we would add both the methods. I would explain later on. And divided by the total number of women of who are married or in consent in a married relationship. In Pakistan, there has been an initiative, Family Planning 2020, where provincial commitments to meet Family Planning 2020 goals related to couple contraceptive prevalence rate has been given, and the percentages that are focused to be achieved by under this initiative are that contraceptive prevalence rate must be raised to 50% at national level, and provincial division is also given, like Balochistan 32%, KP 42%, Sindh 45%, and Punjab 55%. These are the targets to be achieved under Family Planning 2020 initiative. So these are the percentage distribution of currently married women by contraceptive methods currently used, and showing the higher rate of contraceptive prevalence rate in Islamabad, followed by Punjab, then KP, Sindh, Balochistan, and also in AJK and Gilgit-Baltistan. Uh, all of these percentages are below 50%, and the target set is more than to raise up to 55%. And overall, 34% of currently married women use a method of family planning, with 25% using modern and 9% using traditional. And this data has been taken from DHS survey 2017-2018. Now a little about the unmet needs of family planning. So the unmet needs of family planning, actually the unmet needs is defined as the percentage of women of reproductive age, either married or in a union, who have an unmet need of family planning. That is, they are either want to stop or delay childbearing, but they are not using any method of contraception. So the women with unmet need are those who are sexually active, but they are not using any method of contraception, and they report that they do not want any more children, or they want to delay the next pregnancy. So the concept of unmet needs points the gap between the women's reproductive intentions and their contraceptive behaviors. So the factors that are causing that are the factors for the unmet needs for family plannings are partner related factors, uh, perceived low risk of getting pregnant, modern specific methods, specific barriers to use, and generic disapproval of preventing pregnancies, and weak and inconsistent or ambient fertility preferences. So these factors, like access, like perceived effectiveness, safety, and actual side effects of the barrier of the methods, are one of the cause. There is weak, inconsistent, and ambivalent fertility preferences, and people are wanting that they desire to get more children, The side effects, the misinformation about the methods of contraceptions, their side effects. These are all the factors that are increasing the unmet needs of family planning. So the highest unmet needs are age differs in different age groups. While the women in higher age groups falling between 35 to 39 years, the unmet need for limiting the childbirths is the highest. Whereas in younger age groups from 20 to 24 years of age, the unmet need for birth spacing is highest among this age group. And the government of Pakistan has been continuously struggling to improve the availability of family planning services. And however, like many other developing countries, unmet needs of family planning still exists. And from the previous survey, it was 21%. And from the later, the percentages have increased but not met the target of 55%. So this is the graph. And on the right side, there are the unmet needs, that is 26.9% in Pakistan. And the modern contraceptive prevalence is 17.6 to 26.9%. Now, some of the recent advances. There was a concept of telemedicine for contraceptive counseling. It is initially applied in US and other developed countries, but this concept is good. And the family planning clinicians in United States reported a positive experience with telemedicine for contraceptive counseling during early stages of COVID. Like in COVID situations, the telemedicine is a promising option for providing contraceptive counseling even beyond and an investment in hospitals and clinical issue devices via video conferencing may optimize clinicians telemedicine experience. Now it was a good idea to get implemented in Pakistan. So there was a paper that published in 2021, and it highlighted the concept of implementation of telemedicine in Pakistan. So since Pakistan is listed in the lower middle income countries, and according to the DHS survey, it demonstrated that there are unmet need for contraception in Pakistan is very high, and COVID-19 has aggravated. So it is important that we promote these telemedicine services in the health sector, and the health sector should work on providing knowledge to the community health workers and community people to remove through telehealth services to remove barriers of family planning services. Here was another paper published recently showing the socio-demographic determinants for unmet needs of family planning. And this paper concluded that the fear of side effects of using contraceptives have been identified as the major cause of unmet needs of family planning in Pakistan. But the efforts of government, there are efforts, but the clear results have not been shown recently. But there is a hope that if the similar pattern exists and the government efforts continues, then there might be improvement in the current situation. Now it's time for the MCQs. Three middle-aged women came to a family planning center. On inquiring, it was found that one lady is using IUCD, one using oral contraceptive pills, and third lady is using Mirena as contraceptives. So considering these, which one has the lowest pregnancy rate in 100 women using the methods of contraception for 1 year? Either it's IUCD, OCP for the second woman, or the Mirena for the third woman.
Mirena.
As I have already told that the hormonal the implants and Mirena is the commonly used implant, so it is on top priority. So among these three women, the third lady would have the least chance of having pregnancy over a period of 1 year. A free family planning camp is set in a remote village of Punjab to raise awareness as well as to collect the data to evaluate the efficacy of acceptance of family planning methods in an area. So which of the following parameter will not be used to evaluate the efficacy? Either it's the annual general marriage rate, spacing, annual birth rate, and number of accidental pregnancies.
Annual journal marriage rate.
Yes, annual general marriage rate has not been considered as a parameter for evaluation of efficacy. However, the spacing of the children, the number of accidental pregnancies, and the annual birth rates all affect the family planning efficacy of acceptance of family planning methods in an area. A group of students visits a family planning center to learn about contraceptive methods. One of the students notices chart having the formula of Pearl index. With regard to contraceptive failure, the Pearl index refers to what? The number of pregnancies. The number of pregnancies is 1 woman year. The number of pregnancies is 100 women year.
C.
Yes, whenever we are using the Pearl index in the numerator, we use number of pregnancies in 100 women in 100 women year. So the answer is C. Now here is a small calculation. A contraceptive Z is used by 100 couples for a continuous period of 2 years. During this period, 20 women became pregnant despite using contraceptive Z. So what would be the failure rate for this situation? I know it's difficult, but if you just grab the concept that you will put 20 accidental pregnancies in numerator multiplied by 1200 and then divided by 100 into 2 years, that is 24 months, then you get the answer 10 per 100 women year. You can solve this after the presentation is over. A researcher wants to determine the effectiveness of a contraceptive method with minimum chance of time-related bias. Which of the following option is correct in this context? Pearl indexed only, Pearl index and life tables analysis, life tables analysis and couple protection rate, Pearl index and couple protection rate. As I have mentioned in the scenario that the effectiveness of contraceptive method plus the time related bias. So here I am pointing towards option B. And the point of giving this MCQ is that there are two methods of determining the effectiveness, and and when we are using life table analysis, the chance of time related bias is minimum. So the answer is B. Okay, this is related to contraceptive prevalence rate in a village. This in a village with 180 eligible couples, family planning data for contraceptive is sterilization, vasectomy 3, and tubectomy 8. Individuals, IUCD users are 10, oral pill users are 10, and condom users are 29. So effective prevalence rate in this village would be how many percents? I know this is slightly difficult to calculate within minutes. I added this MCQ so that I can demonstrate how
60 divided by 180.
Yes, it would be 60 divided by 180, then the answer would be 33%. That is the right answer. My concept was to just to give you a concept that how you have to add all the methods and then divide by all the eligible couples, and the answer is 33%. Another Pearl Index question, 100 women followed up for 20 months and with OCP 5 became pregnant. So they calculate the Pearl Index. In this, the calculation is very easy, that when you multiply 5 with 12 and into 100, you get 6,000. And when you divide it by 20 into 100, 2,000, you get answer 3. So these calculations are simple when you
Yes, the
add
correct answer is
If I'm wrong, you can correct me.
C. Answer is
Yes,
C.
the answer
Answer
is C.
C.
Yes, the answer is C. A 35-year-old female comes to OPD for consultation. After taking history, the doctor points the gap between women's reproductive intentions and their contraceptive behaviors. So unmet needs for this female of this age group is mainly for birth spacing, limiting birth, spacing birth, improving maternal health, improve family health. As the age groups is higher side, that is 35 years, so here the unmet needs are for limiting birth, so the answer is B. A 28-year-old female comes to OPD to avail family planning services. Which of the following will not be done keeping in mind the scope of family planning services at the healthcare facility? So what services would be provided at a family planning center, and what things should be considered for keeping the scope of family planning? Either it's screening of cervical cancers, providing service for unmarried women, providing contraceptive advice, and screening for HIV infections. Yes, screening for HIV infections is I would like to add a point that recently they have added that the cervical cancer screening is an important part whenever a person comes for a family planning service, especially for the young age. Sorry, I forgot to mention this point in my presentation. So the answer would be D. Screening of the HIV infection is the thing that is not currently being done at the family planning centers in the country. Sorry for my mistake. Which of the following is important in calculation of Pearl Index? Number of abortions, total accidental pregnancies, socioeconomic status, total gestation period.
B.
Yes, I gave this. Apparently, it looks simple, but I gave this MCQ because in several scenarios, I have seen total pregnancies and some highlighted total accidental pregnancies. So I highlighted here that for Pearl Index, we always consider total accidental pregnancies. Here is the key, and thank you.
Thank you very much, Dr. Amber. A very comprehensive presentation. There are a few points that I want to highlight. Number first is the family planning word. It is now not more in use in Pakistan. In Pakistan, what we are using is the family health. Why? Because the family health includes contraception, maternal health, as well as nutrition. And in Punjab, we have I, R, M, N, C, H, and N. But it is for family health. And another important point is that all those activities that were under the family planning are also under this organization that is governed by the government, IRMNCH and N. And the second important thing is that the family health, that word attracts more people as compared to the family planning. As we know that the family planning is a word that has certain taboos associated with it. Especially in our culture, we have seen that even the polio drops and even the COVID vaccines, they have been linked with the family planning services. However, we know that they have nothing to do with family planning. Whenever there is some propaganda or misinformation, it means that the new words has to be used in order to give the boost to the existing services. The second important point, as you have seen, you have told about the recent advances. Yes, telemedicine can also be used in family health. Another important thing that comes under recent advances is about vaginal rings, because we have seen that vaginal rings is not only helping with the contraception but also with the sexually transmitted diseases. The two important aspects of family health is decrease of sexual transmitted diseases, including HIV, syphilis, toxoplasmosis, and many others. So even herpes and hepatitis, especially hepatitis C, these are some of the diseases that can be prevented. In one of your MCQ, in MCQ 9, you have shown, yes, please, that a 28-year-old female comes to outdoor to avail family planning services. Which of the following will not be done, keeping in mind the scope of family planning services at the healthcare facility? So when we talk about family health, especially all those services of family planning are now under family health. The screening of all those diseases that are sexually transmitted, it is the part of family health. So I think here we are getting the wrong message that it should not be done. However, actually, it should be the part of any family health services that are being provided. Another important thing that I want to emphasize is in recent advances that are very special for Pakistan is the token system. Dr. Amber, do you know what is that token system?
Um, no, ma'am, I don't have any idea regarding this token system.
Right. As we know that in most of the areas, there is the unmet need of family planning or contraception. Many people, they want to have a family limitation or a proper spacing within their child, or the maternal health is so poor that there is a demand